Good afternoon, everybody. I just want to let everyone know who is watching us on the live stream, who is all involved in this meeting. Members of the Health Board, we have Mayor Nathan Johnson, Dr. Mary Milroy, myself, City Manager Amy Leone. We have our Community Development Director as ex officio, Dave Mingo. We have our Community Development Manager, Brad Beese, as ex officio. We have Commander Jason Foote from the Yankton Police Department as ex officio, and we have Ross Den Herter, our city attorney, as an ex officio. Today, we really have one order of business, and that is to make some recommendations to the City Commission regarding the ordinance 1033 and how they should move forward. We have invited Dr. Mike Podila, pulmonologist from Yankton Medical Clinic, to join us, and he has been gracious with his time enough to do that. So I would like to hear from him. He has some other commitments, so he may need to jump off. So I'd like to hear some of his thoughts and let our health board ask him questions first, and then we can deliberate so he can move on with his day. So thank you, Dr. Podila, for joining us.
Sure, I'm happy to try to help out. And of course, I'm going to present things from the public health perspective because that's what I'm most interested in, you guys understanding. And then the tougher decision will be, how you want to handle the economic and business and government impacts of it. We had a meeting this morning with the Department of Medicine at the Sacred Heart Hospital, where Lindsay Flannery and Doug Ekren, two of the administrators, presented some of the data regarding when we're expected to have our peak. You guys got that from Dr. Basil before? I thought you did. And so the same graphs that they showed us, I think he showed you, where we're going to see this peak of 165 potential hospitalized patients near the end of June or early July, and then different variations of that and what impact that might have on our ability to care not only for the COVID-19 patients, but also for other patients in our community, how that might limit our access to hospital beds, to hospital staff, to physicians and mid-levels, and then also how that might affect our supply of personal protective equipment and, ability to care for patients who aren't sick in the hospital. Because if all the doctors are stuck at the hospital, taking up all the equipment and using all the resources, then we aren't going to be able to provide care outside of that setting. And, this is just a model, of course, and models aren't meant to be right or wrong. They're just meant to inform us and to give us usable information. And so if you look at that model and you use that information in a meaningful way, it would seem to indicate that whatever we can do to continue to minimize the risk of this becoming more prominent in our community is to continue what we're doing, at least in a very similar fashion. I understand that there's some discussion out there about herd immunity and letting the younger generation or the younger people who aren't subject to have severe an illness and whose mortality rates are less than 1%. And in fact, the likelihood is somewhere near 70 to 80% of people maybe don't even have symptoms from this virus. And that those who do get those symptoms are mild. And so it's only going to impact maybe 20% of our population. And of that 20%, probably only 10% of them are going to get sick enough to need hospitalization. But if that all happens soon enough to one another, we'll be greatly overwhelmed. I think we're going to be able to gather more information from communities that are opening up in other states. More information from outbreak areas like Sioux Falls that will help us better adjust our model because they're expected to peak earlier in Sioux Falls. And maybe if their peak's not as high, we can talk about, adjusting things. If their peak is more severe, maybe we can talk about being more restrictive. But I think we need to take advantage of the opportunity to gather more information. Part of reopening is doing so in an organized and safe fashion. And from a public health perspective, that involves access to more testing and the ability to trace contacts of those individuals who test positive. And we don't have that in full force yet. We keep getting information that we we will, or that we might. And given more time, I think we will have more access to testing, which will better allow us to reopen in a safe fashion. We are starting to do serologic tests at the clinic where you can measure for the antibodies. We don't yet know what value that's going to be. Probably isn't, well, it shouldn't be used as a diagnostic test. It just means that someone was exposed and that they're likely, well, I wouldn't say likely, that they might be immune. And that might matter going forward with respect to who can safely be out in the workforce. Patients who have the antibody can still be infected with the virus for 20 plus days. So the presence of the antibody doesn't mean they're not contagious. But again, it's another tool that we're going to be able to employ as we move forward in this. I don't think I had a whole heck of a lot more to say. I wanted to get that information out there. And then what sort of questions do you guys have?
One question, Dr. Podila, that I've been asked to ask you is that if the commission would decide to let its ordinance expire or determine that some businesses could open, is there a safe way of doing that, and what your recommendation would be if they are going to open? And then also generally, what would you recommend from your perspective, just in general? Should the commission be considering expanding that ordinance, lengthening it, or starting to open things up?
Yeah, I sent you a message from a Harvard publication, just a link quick, Amy, that you can kind of look at on how to safely reopen businesses. And, you know, they talk about some of the things I talked about, including testing and eliminating the presence of the virus from the workplace, personal protective equipment like wearing masks, and ways to, you know, manage personal distance within businesses. Again, from my perspective, and I prefer not to be directly quoted. Some of my colleagues at the clinic don't like my opinion out there regarding this. You can say a healthcare provider would be my preference, but I think for public health's benefit, and again, that's where my main emphasis is here, it'd be best to extend the restrictions for the most part, especially as it would pertain to any business that's going to involve close contact, like a hair salon or tattoo parlor or video lottery establishment. And, you know, the problem I see if you decided to open up places that offer dining in, you know, how do you police whether they're practicing social distancing? You know, I know ideally we'd all be very responsible and make proper decisions about how to handle it personally. But, you know, I saw what was going on at Stringer's and out by the lake when the city put their restriction in place before the county. I don't know what Kristi Noem's going to say, Governor Noem. You know, she's been cautioning us about reopening. We want to start doing elective procedures for our patients who need surgery to get done, not urgently, but they still need their procedures. She hasn't given us permission to do that yet, but we're exploring and putting into place a plan to start doing that as soon as she gives us permission to do so. And so I think it's important to be looking at ways that we can reopen. But if you again look at the data regarding when we're expected to peak and just how severe that peak is anticipated to be based on the model, it's too soon to open everything up.
Dr. Podila, this is Mayor Johnson. Thank you for being here today. And I don't know if this is a question you feel comfortable answering, but it's a question we get a lot, or a sentiment that we hear a lot, in that, yes, there's the public health side, but what about the economic side of this and the public health concerns around people's economic well-being and how that plays into their mental well-being? Do you have any advice for us on how to balance those interests at this point in time where we're at with this pandemic?
Yeah, and I hear that from my colleagues all the time, that we're, throwing the baby out with the bathwater, and it's not that big a deal. It's just a virus, and it's only going to kill a very few people, and those people are likely to be elderly, and that's all fine and dandy. But the reality is, if we have a spike like they are predicting based on the models, it's going to be big trouble. And if we open up society, knowing that the only way to mitigate things, we didn't contain it because we didn't have enough testing, and that ship has sailed. And so now we're in the mitigation phase, and mitigation, the only way it works, unless you have a vaccine, is to isolate people so that the ones who are infected don't expose those who are not infected. And I think you have to quote the numbers that you've been provided by the Avera model, stating, like you have, Nathan, in the news media, that the wave is in front of us. We have not reached the peak, and the only way to avoid that from being more severe is to continue to flatten the curve. And the only way to flatten the curve is to practice social distancing. Now, the argument's going to be, well, we aren't New York City, or we aren't Smithfield Foods, or Tyson Plant. And no, fortunately, we are not. And we need to do everything we can to prevent becoming that. And, there doesn't seem to be as much, well, look, we don't have any cases, we've overreacted, why are we still doing this, as much as there is, we got to get back to generating, dollars and get our businesses going. And that's a tougher situation. I'm not an economist, and I'm not a business person per se. I've become one in my role as a member of the clinic, but we're feeling that same pressure. And what I prefer to focus on is getting more assistance from the federal government or the state government to help our small businesses, focus more on that, get what we need to help protect our public health interests, which is PPE and the ability to test more people. I really want to put the focus on those issues, as opposed to, we just need to open things up so that the economy doesn't sink. I wanted to touch quickly on this idea of herd immunity. I think there's been some, chatter out there from non-experts suggesting that if we all just get together like they did with chicken pox or something, that enough people will get it, that then we can be considered immune. And that's flawed logic, especially in the case of a coronavirus. This isn't the mumps or chicken pox or the measles, where everybody who comes in contact with someone who gets it, 10 other people get it. And we have an excellent vaccine for those. You can't develop herd immunity in a disease where only 60 to 70% of the population is likely to have it at any given time because of its reproductive rate, without a vaccine. And we're not going to have a vaccine for 12 to 18 months. And that's probably wishful thinking. Most of the time it takes 3 to 4 years to develop a vaccine. So herd immunity, although it's an interesting concept, is not going to get us out of this.
So I guess the other question I would have for you, Dr. Podila, is, I know this it's a coronavirus, it's not the flu, but if we look at the last 10, I believe, flu pandemics, there's been a second, even larger wave. At this point, how much insight do we have that this will be coming at us again in perhaps 6 months? Because I guess that weighs on my mind. The decisions we're making today, I don't think will be the last time we're dealing with this virus. It's just going to be part of a cycle for a while.
Yeah, you're absolutely correct. I mean, all models and all prior, experience with similar viral outbreaks indicate that we could expect this to be with us for years, if not our lifetime. And so it's important to start to learn how to live life with coronavirus going forward. And I think we're doing that. And we're in the process of learning even more about how to best do that, especially in communities that are starting to open things up. The CDC director, those experts in epidemiology are all confident that we'll have another surge. And hopefully we learn a lot from this one so that we can be even better at the time of the next one. And so you're asking, what about that person who says, well, we're never going to be out from under this? why isn't now just as good a time to open things up as, down the road 2 weeks or 4 weeks? And of course, I don't have a crystal ball, and so I don't have all the answers, but based on the available epidemiologic data, our lack of ability to test as many people as we think we should be, and to do contact tracing, I think the risk is greater than I'm willing to accept to open everything up. Now, does that mean that the benefit of opening up isn't? I don't have the answer to that. I'm speaking primarily from a standpoint of protecting the other patients, protecting my healthcare providers, nurses, and support staff from getting overwhelmed and experiencing, the turmoil that's going on in places like New York City, and likely will be going on in Sioux Falls. And I heard from some colleagues in Sioux City yesterday that they intubated 8 people in one day, just in Sioux City alone. And, there's likely to be a whole bunch more of those. Now, we don't have a Tyson plant or a Smithfield plant so far. So that's the tough part.
I guess that's part of my concern too. If you look to our north in Sioux Falls, to the east in Sioux City, to the south in Madison and Grand Island, there are some huge outbreaks. And yes, a lot of those have been tied to meatpacking plants. But, those are individuals that certainly visit our community as the weather gets nicer, the lake opens, or the lake is open, but as people visit the lake, it increases the chance of spread. So I guess all of those factors just weigh on my mind as I consider what to do next.
And as they should. I mean, I think the idea, I perfectly understand those people who are saying, I'm young and healthy and I'm not likely to even get sick if I get the virus. I need my income. I need to get my employees back to work. My business is in jeopardy. That's all, horrible to hear. And we're in the same boat at the clinic. There's only so much cash that we can have around. And if we're not generating income, the bills don't go away. And so we are making every stride to do as safely as possible what we can to get back to business as usual. And I don't think that the general communities quite have those resources at this point. We don't either. I mean, we can't start doing surgery tomorrow. We're still stockpiling PPE, and we're still trying to understand the utility of the serologic testing in addition to more availability of the antigen testing to help us decide who can safely have procedures done. And unless you guys have a system in place that I'm not aware of that will really allow you to monitor carefully what it is to be safely reopening, then I think the better part of Valor is to be wise and to continue to prepare, and then begin, maybe make a plan to say, here's what we're thinking right now is too soon. We're going to gather more information from communities around us where there are outbreaks. We're going to take that information and we're going to push for testing, and then we're going to open up, whatever sorts of things you think. I know some communities, they're saying indoor dining at 25% of seating capacity. How do you enforce that is the problem that comes to my mind. Is, I'm seeing pictures from places like outdoor dining. Well, then there's a table of 10 people sitting 2 feet apart from each other and a waitress without a mask on taking their orders. That's not really consistent with social distancing. I also recognize it's a free country, and government restricting your independent businesses, you have to make sure that they understand it's on the basis of public health and not for any other reason. So I don't think there's any, I think if you were to talk to Dr. Basil, if you were to talk to Kevin Post, the CMO at Avera McKinnon, if you were to talk to Doug Ekron, Lindsay Flannery, who are the administrators at Sacred Heart Hospital, if you were to talk to our board at the clinic, be supportive of continued restrictions to protect the public's health as it pertains to the likelihood based on the models for a spike here in Yankton. And nobody knows. I mean, I could change my tune in 2 weeks and say, we should have reopened 2 weeks ago. I think that's highly unlikely, but I don't know that. I mean, I would have anticipated that we'd have more cases right now than we do.
I know there are an assortment of reopened plans out there from the White House and nonprofit groups, but from what I've seen, we don't meet the criteria of any of those plans to reopen at this point. Have you seen anything different, Dr. Podila?
No, so based on the phase one, the White House plan, phase one is where we're at. We're in the process of gathering the data to meet the criteria to satisfy phase one, so that we can consider reopening for elective procedures. We still don't have permission from the governor, so it's not relevant from that perspective, but we want to be ready to go, the first day if it makes sense for us to do that. But we're not at a point where we have enough reliability of hospital bed availability and PPE supply at the clinic. At the hospital, I think they're pretty much ready to go based on the PPE they have, and also the need to get some of these surgeries that are going to require hospitalization done before the hospital is closed to admissions because it's full of COVID patients. Another threat to our hospital beds is the fact that, we're part of the Avera system, and they're certainly planning, if they reach capacity, to send patients from Sioux Falls here to Yankton to get their care in our hospital if theirs is overloaded. And their models suggest that that's highly likely. And so, even if we tamper our peak wonderfully here in Yankton, we're still at risk to become overwhelmed by the outbreak in Sioux Falls.
This is maybe more of a lament than a question, but I think the city's in a really tough place because we've been entrusted with making the decision as to whether to close or limit business in our community, yet we are not involved at the state level where they're making the decisions on expanding testing, contact tracing, those things. We hear those things maybe a little bit before the general public does, if we're lucky. But it's like here's the problem for you, but you're not involved in the solution. And so that's where I have a lot of frustration.
Yeah, and I feel the same. Through this whole process, I was expecting it to be much more transparent with respect to, what testing would be available, what the turnaround time on the test would be, how we get more PPE, where's the PPE at, and that's not been available to any of us really. And so you're kind of out there coasting, and I'm, genuinely concerned if we get a large number of these patients into the hospital that, number one, we're not going to have enough PPE, and we're going to be like places where nurses are either being forced to quit or being fired because they refuse to go in and take care of patients without appropriate protective equipment. Or we're not going to have access to things like ventilators or high flow nasal cannulas. Really ventilators accelerate the pattern of worsening in this disease and death. And so we're doing all we can to avoid that. And we have equipment to prevent intubation and ventilators, but if we have too many patients, we don't have that. And so I share your lament with respect to, what the governor is able to tell us as far as the support that they can give. But I think that's just another reason why, taking a leap forward and reopening everything is not likely the safest way to approach it. And I'm trying to gather as much as I can about, epidemiologic data to say how it is safe to reopen in a pandemic. But the thing you can't do is what they did in 1919 during the Spanish flu in cities like Philadelphia, and then see that happen. And granted, again, we're not Philadelphia, but that's lessons that history, and we know history can repeat itself.
Yeah, another part of the challenge here is taking this on at a community level around the state. For example, if you go to Mitchell, the hair salons are still open. If you come to Yankton, they're not. Vermilion, they're not. but somewhere else they are. And so people look at that and they say, well, there are fewer cases there, so are you really changing anything? And we just don't have enough data around that to know, I guess, what the right answer is. Hopefully someday.
Yeah, and I think, the hard part about leadership and governing is we all want to get it right every time. And that's impossible, as we all know. And so all you can do is take the information that you have available to you to approach it in as much of an unbiased and, non-political fashion. And I get the sense that this commission and the mayor have been very good at that. I would say at the state and federal levels, not quite as good at that. And, be willing to understand, as you guys do, that a large portion of people are going to disagree with your decision no matter what. There's a whole lot of people who've come to me saying, don't let them open up. This isn't safe. We're listening to the CDC and to Dr. Fauci, and we don't think it's safe yet to do this. We don't know that we've reached our peak of cases. We don't have enough testing. Until we have that stuff, don't open things up. And so I think where's that number lie? When I look at surveys that I see based on the people that I communicate with regarding it, it's 80% who say it's too soon to open up versus 20 who say it's not. But again, I'm not talking to small business owners in that setting who are being forced to close their doors, or people who frequent those particular businesses who rely upon it. So again, I don't envy the position that you guys are in. Again, from my perspective, as someone who does own a business and who does want to get back to more normal, we're not ready to do it here. And we think with a little more time, we will be ready to do that. I don't know exactly how much time.
Other members of the health board or ex officios have questions for Dr. Podila?
Ross?
Doc, earlier in the conversation, you indicated that there were you made a comment about what your thoughts were specifically about salons and other businesses where people are close to each other. What was specifically your recommendation on that specific class of businesses? Could you repeat yourself on that?
Yeah, so we know close personal contact as defined by the CDC is being within 6 feet of another individual who you don't know well for greater than 15 minutes. Back when they first established what close contact is, it was 6 feet for 5 minutes, but they've extended it to 6 feet for 15 minutes because that puts you at the highest risk to contract the virus from someone who's asymptomatic and has it. And so, you can envision a restaurant being open with 25% of their tables and chairs available, groups of no greater than 4 at a table that allows 6 feet distance, unless they know each other, which then is a different situation. And then the ability for a waitress or a server to take their order from greater than a distance of 6 feet, and then, not buffet style, but put their food out on a ledge where they walk up and then take the food and go to their table. But in a salon, how can you safely distance yourself from someone when you're cutting their hair or doing their nails or doing that sort of stuff? And so without the ability for PPE in that setting, which we certainly can't be using PPE in salons or tattoo parlors or someplace when we're trying to reserve every bit of it for the purpose of healthcare, that's just too high a risk, I think, for transmission of virus from one person to 3 or 4, who then transmit it to 12, who then transmit it to 36, who then, as you understand, exponential growth. Well, I greatly appreciate all that you guys are doing. No matter what decision you make, it's not right or wrong. Make it be useful and meaningful so that no matter what happens, we can, do something valuable with the results. I'll keep my ears and eyes open on everything I can from a medical perspective as it pertains to the reopening and how people are doing it right in certain places or wrong in others. And if it's valuable to give my opinion to you again regarding that, I'd be happy to try and do so.
Yes, it would be. Thank you very much for your time this afternoon.
Yeah. Thank you, guys.
Thank
Good
you.
luck. Yep. Bye.
Yeah, thank you.
Well, Health Board, I told the City Commission I would give them some type of recommendation before their meeting. So I think we should deliberate a little bit here, what we think we need to recommend. I realize we have 3 voting members, but this is one of those times where I think everyone's opinion should be weighted and evaluated. So what are your thoughts and comments, and where are you sitting today?
Okay, I guess I'll say kind of what I think here. I think that the as a health board, our responsibility is to give a best practice, best medical practice opinion to the City Commission. The City Commission will take that input, and then they have really the harder task, I think, of then weighing the medical opinion versus maybe what they're hearing from their constituents, what the economics of the city are, and come out with their final decision. But I think that from a health board, we need to stay primarily basing our opinion on public health and what is good for the health and safety of the community. So that's how I'm looking at this. We've asked a number of experts to come in and give us opinions, both from kind of a regional area as far as very local. So we've had Dr. Specker as a very well-educated epidemiologist. We had Dr. Basil give us an opinion as far as the systems. We had Dr. Podila give us an opinion as far as our local situation. So I think we have kind of done our homework and got some opinions. I think there's one word that comes out from every one of them, and that is we haven't reached our peak yet. The numbers are going up. Fortunately, they seem to be going maybe slower than initially predicted, but they're still going up. They haven't started to go down. We haven't reached our peak. There's a lot of infection around us. We look to Sioux Falls, we look at Sioux City, we look at Nebraska. We're kind of surrounded by it. I guess I would feel that in looking at the criteria as far as like testing, contact tracing, hospital capacity, pretty much everyone we've heard from says we're not there yet. When I look at the criteria for opening, I just don't think we're there. The fear about going too fast is that we could have a resurgence. And the problem also with the resurgence is then we go back to square one. Everything we've done so far is kind of lost. So I just think that, Yankton has 27 documented positives. Fortunately, we have not had any deaths, but we are still listed number 4 county in the state. And I think my recommendation would be that we recommend to the city council or city commission that they stay closed for at least the next 2 weeks to bring them to their next meeting. I know Dr. Basil's predictions looked like by early May, we should have a much better idea of whether we're following the curve or falling off the curve, either low or high, and could adjust things. If we find that things are very much favorable, I think we could relax earlier. I think that's unlikely. My recommendation is that they stay where they are till their next meeting.
I agree with that, Dr. Milroy. The only change I would maybe be willing to get behind is dropping dog groomers from the list. That wasn't part of our original recommendation, and I think they can work out a way to do that without much human interaction. So that's the change I would be willing to make from a health board recommendation standpoint. But I agree with you from the health board's perspective as recommending best practices for public health. What we've heard is clear. There's been no confusion about where we're at in this and what we need to do based on what we know now. We've found with this virus, we learn more every day. We collect more data every day. And I would say, my goal as a health board member is to get to the day when I can recommend that we can reopen things, whether that's in stages or whatever. I mean, that's where I want to be. But based on what I've heard so far from all of these experts and what I've been reading, it would be irresponsible to recommend that we start reopening today based on where we're at. And so I'm right there with you.
I'm completely with you on dog groomers. I think as long as they do safe practice, they distance, they clean the leash and whatever before contact, and they do mask when they're interacting, I would think that would be fine too. I have no problem. And also, just as an FYI, in this morning's Washington Post, Dr. Ben Aker, who is a Sacred Heart emergency room physician, had a op-ed in the Washington Post today that just said, South Dakota, we never closed down, but doctors like me wish we would. So there's just another local physician weighing in as far as, from the emergency room point of view, best practice.
Trusted ex officios, what are your thoughts?
I'm in the same boat as Dr. Milroy and Mayor Johnson. I haven't heard any healthcare professional say that now is the time, to start relaxing things. And I'm not a healthcare expert, but based on everything I've heard, I'd like to take it, week to week or 2 weeks at a time, just because the statistics could change in a matter of days at any given point in time. But as a health board, I think our role is pretty specific to be discussing what's best for public health. And as Dr. Milroy said, at this point in time, I would say extend it 10 days to 2 weeks at least, to have this discussion again, which, we're not real excited about doing, but hopefully at some point that news is good. And the commission is going to have a difficult decision because they're considering a much broader range of items than the health board is.
This is Katie Heff. Can you hear me okay? Okay, I'm glad my mic is working today. Last time it was not. So I just wanted to, number one, thank everybody for their dedication. I forwarded an email last week following Thursday's meeting, and I would agree 100% with all that has been shared today. It is absolutely, our responsibility to look at this from a public health perspective and make recommendations based on science and the best information that we have available to us at the time. And that's, you outlined the information that's been provided to us by many experts beyond just our specific community here in Yankton, but also the broader community of South Dakota. And so I think it's important to really factor those things as I hear you all are doing in the recommendations to the City Commission. I think that it's important for each of us to read Dr. Post's op-ed. Thank you so much, Dr. Milroy, for forwarding that on. It really highlights not just the hospital, the potential for hospital systems to being overwhelmed, but really the end of life scenarios that, our own neighbors or community members could be faced with. So I think that seeing how that can really play out It's not just something that could happen in New York City or Washington State, that could happen in our own community and could be our own family members. So I would encourage, and I hope the city commissioners have the ability to read that as well as they factor those things into their decision making. So thank you.
Yeah, I have to agree. There's no scientific or medical evidence that suggests there's any basis to start opening things up yet. I would actually go one step further than dog groomers, although I don't think there's a big public outcry about this particular issue, but the tanning salons as a specific form of salon doesn't really have the same sort of physical connection that your hairstylist has. And I think that a logical argument could be made that tanning salons, as long as staff were exercising appropriate clean down techniques and there was a good scheduling process where people weren't bumping elbows with each other on the way in and out, seems like could be one that could be taken off the list too. But that's my only additional thought. I echo everybody else's sentiments to this point.
This is Brad Beese. I don't know that I have anything to add to what's already been said, or that I have any particular insight beyond on what folks have said up to this point.
I'm going to sound like a broken record because I agree with everybody else here and what they've stated. I also continue to watch, again, Beetle County, and they have not had another increase, but yet we have. So I just don't see us being in this position with all the data that we've looked at that we should be opening. So again, I disagree with the group.
Does anybody know if Beetle County has done anything differently, if they've lifted their restrictions at all? I guess that's a question that I don't know the answer to.
Amy, I can find out that information from Beetle County City Attorney before the work session tonight if you'd like me to.
Yeah, that might be useful. Thanks, Ross. I do know there are a number of communities, Spearfish being one of them, who has already or maybe is considering this evening, if they haven't already, lifted some of their restrictions that they had. Rapid City, I believe, is considering that this evening. I think the city of Del Rapids, they're just north of Sioux Falls, is talking about that as well. So we're not unlike the other communities. So sorry to put you on the spot, Brad, but saying you have nothing more to add, are you in concurrence with what's being said, or do you have a different opinion?
No, I mean, I think it's challenging with what you just said. And in looking at other communities, I think Mitchell is considering tonight as well. Can you help me understand? I think as I understand those changes from other communities, they're suggesting moving towards something that models the executive order as a 10-person thing rather than a business specific. Is that how you understand it?
Yeah, and it varies slightly. You know, some are looking at opening up some things and not others. Some are looking at opening up everything with restrictions. Some are going away from their ordinances and focusing on, like you're saying, more of the executive order. I was on a call with the governor this morning, as was Mayor Johnson, and the indication we got from Governor Noem was that tomorrow she would have some different announcements to make that may, not for sure, but may consider reopening strategies for the state. But she was still waiting for some data and information. One of the things I have asked the commission is that if they want to make some changes to their ordinance, that they try not to do that in the meeting tonight, rather direct us as staff and set a special meeting further out in the week so that we have some time to work on language, so we're not crafting language in the meeting. So, that could get difficult. For example, if they want to do something different with restaurants, we've got the model where there's a certain occupancy. We've got a model where there's distancing. We've got a model where there's outdoor dining. So there isn't one, again, even consistent throughout the cities, even though we've tried. We're just all different. And certainly there's different situations because there's different levels of infection too. So, and pardon me, I was going to say our ordinance was on the more restrictive side, to be fair, than some of the other ones were to begin with.
So I guess maybe to be really specific, no, I don't think life as we lived it before should be something we're trying to get back to right now. As to exactly which of those, because I think I've read the same number of daunting variations, both in South Dakota and everywhere else. Do I know which one of those? Maybe I'm going to quote Dr. Podila and say, I don't know if I know which one of those makes the most sense or is the right answer. I think some community mitigation is absolutely the direction that we ought to take. I struggle to know what exactly that is. I know it's confusing for people when there's a lack of consistency. So if I have any hesitation, it's just that I do think people, generally speaking, want to do the right thing and they want to participate in community efforts to stop the spread. I think that's a fairly universal truth, but it is confusing when places not that far apart do different things, and that's part of my challenge, because I wonder if even if it was the wrong choice, if we were all more similar, we might be more successful, as strange as that might sound.
No, I understand what you're saying. Other things to talk about or other things we should discuss?
Dr. Milroy, what's your opinion on the tanning salons? I'm only familiar with one local business owner who has called me and has shown me that he believes he can have customers come in and out without human contact. It's automated. People will sit in their cars until it's time for them to come in. So, I have mixed feelings about a situation like that where, maybe a business could have customers come in and not put anyone in danger with the social distancing measures. I think it's different from hair salons. But I don't know if that's the way all tanning salons operate in the community. I honestly don't know.
I guess I've not ever been to a tanning salon, so I'm kind of trying to envision this. But, I would say that I agree with you, but I would, in the opening, put those kind of requirements and advisories in place that if they adhere to those, that maybe that would be something that would be allowed. One of the other things that does seem to be in a number of the phase 1 type openings, which I don't think we're quite there yet, but even like some of the gyms, I did read the letter, and I would, I don't know if we're quite there right now, but in some of the early openings, I would be open to that because they have a very set plan where there's not interaction. My main concern with hair salons is that it's close contact. You cannot possibly work on someone's hair without touching them and being in close contact for more than 15 minutes. And so that one, I know we've had a lot of input on that one, but that one seems to meet the very close contact. And we've seen from some of the, like the meat processing and things, that's when people are kind of shoulder to shoulder, that's the risky time. So some of them where we can really work hard at distancing and masking, I would be much more, I think we'd be much better ground to loosen up on some of those first.
One other thing that I promised several people in the phone contacts over the last week that I'd mentioned, we've had a number of specific references, and this is something that isn't is more state related than it is city related, but they wanted me to bring it up at the health board. Had a number of specific references about campers in the community and out of state influx of visitors this time of year. And the people that have commented just wanted to make sure that everybody considering regulations, advisories, or ordinances, are aware that that's a huge number of people that come in and out of our community and our county and our area based on tourism. And some of those comments were more to the effect that the state should have the campgrounds closed and we don't have control over that. But I just told them I'd pass that information along or those comments along. So more to think about.
Yeah, I know the CVB, Casey Haberman, has some information about that. The state has not closed their campgrounds, so what she's trying to do is focus on promoting safe camping for folks that come, both for the campers and our communities that are receiving them, and making sure there's education about what information and regulations we have as a community. So that's been her focus. We have a number of campgrounds too nearby that are not in Yankton, but use Yankton kind of as their primary, I guess, quote unquote, town, for lack of a better, if they do need supplies or food, or, they go for pizza or what have you. So she's doing her best job there to work with the state. That can be a little problematic in that some of the services at the campgrounds are not going to be open. So folks will be looking for those services, but yeah, appreciate those comments. So where do you land on, I guess what I'm hearing from folks is that they don't recommend any exceptions with maybe tanning salons and dog groomers. Are you looking at a recommendation to keep the current ordinance in place? Besides those two types of businesses for another 2 weeks, which would put it at, maybe May 15th, or are you, how would you like to form the recommendation?
I would be okay with what you said and recommending, I guess I would recommend 2 weeks that the ordinance stay in place, but with those exceptions that we would allow dog groomers and tanning beds.
Are we just?
That's right.
Just opening up dog groomers and tanning beds?
I guess maybe that leads to another part of this whole discussion is, even if you look at Rapid City's plan to reopen, there's all kinds of requirements they're talking about for these businesses. And, what's realistic as far as the health board making recommendations for this is what businesses need to do to reopen versus, how much can Brad and Dave and their team do for policing that and making sure it's happening and fielding those calls, because they'll have businesses wanting them to come in, because I think a lot of businesses really want to do the right thing. So they'll want to call you guys and say, hey, this is what I'm planning to do. Does this meet your requirements? And where do we go with that discussion? What's the best way forward?
Well, I guess I'd be delegating all this, but from my perspective, the recommendation should be pretty general when people do not because I would want to be loosey-goosey about any of this, but because our ability, again, to enforce, and we trust our business owners, and that's work. That kind of enforcement, telling people what the rule is and trusting them and then communicating with them a lot between Brad and Dave, myself and Ross and the police department. We've been constantly communicating with people, and they've been communicative with us. So that's worked. So, I think general recommendations, if you're going to open something up and say, for example, we're okay with tanning beds or dog groomers, provided that they follow the CDC guidelines as appropriate as possible for your intended operation. Because so one person has a tanning bed operation that's got 15 beds, they're going to operate different than somebody with 2 beds, for example. And we've heard that with salons. They have, some salons are one woman shops or one man shops like barbers, and others are or more sort of the group type settings where there's 10 or 15 chairs. So maybe that's a little exaggerated, but so I feel like being more general on those restrictions is better, and let us help walk through those with people. If there's a concern, someone will bring it up to us and we can contact the business, and walk them through that. The PPE, for example, might be an issue. We could say something, must wear masks, but that might be a very big issue for a type of business. So, I think, following the CDC guidelines as appropriate for your business, and making recommendations like socially distancing when you can, that type of thing. I think if we get too far into minutia, once we are going through reopening, that could lead to a lot of problems. But maybe code enforcement and our city attorney want to chime in there, because like I said, I have the value of once the commission makes the decision, I say, okay, guys, implement.
I do want to say that I agree completely with the comment that the CDC, in cooperation with OSHA, has put together some guidance. It may not be something everybody loves, but it's things that form the basis of their recommendation for all industries. They do have some very specific industry-specific guidelines for retail, for manufacturing, for construction. We've begun to already encourage those things with the contacts that we have. I know that YAPG and the chamber are doing exactly the same thing. I would, I guess, strongly be behind Amy's comment about a general sort of requirement, and maybe referencing those best practices as identified in the guidance from OSHA and the CDC, because they're updating those things. They're the ones who know much better than Dave and Jason and I do about how you might organize it. And those guidelines do kind of envision a time when more PPE might be available, but they also provide some, when PPE is not available, try this sort of guidelines where, again, you might have an ideal goal somewhere up here and a reality of what's available somewhere lower than that.
I think that's where we're going to be for a while, is reality versus ideal. Go ahead, Ross.
Yeah, my 2 cents are similar to Brad's. I think it becomes a terrible game of whack-a-mole to try to regulate every different type of business. And my goal is, if we're going to have a regulation, it's got to be meaningful in the sense that our staff and myself can actually enforce it. And I think if you try to go further than just do what the CDC in the state of South Dakota tell you to do, it just becomes an unmanageable beast. And one thing that I think was quite helpful, I listened into the phone conference with the governor this morning, and there was a direct invitation if there's a business owner that is looking for guidance in a safe way to manage their business, to call the governor's office and ask for a recommendation. And we were informed that would be provided on a case-by-case basis. So I think it is, that's finally an opportunity to put some of that burden back on the state. And, not that it's a tug of war here, but I'm not necessarily sure it's our place to tell everybody exactly what they ought to do to keep their individual patrons safe. It's just important that I think we just make it clear that they have an obligation to use best practices.
I can't envision a format or a scenario where we are doing on-site inspections at every business with tape measures, and there's just this, we just don't have the people to do it. And plus, in doing so, you'd be kind of contradicting the whole intent of what we're doing here as a community and a health board, as far as restricting access and encounters with other people. But I agree with Ross and Brad that I would continue to recommend saying CDC advisory or governor's advisory even, and refer to the language included in those documents as they evolve. Because if we start to pick out, 100 different kinds of businesses and then come up with a separate rule that applies to each business, there's no way we could do that. And meanwhile, our regular non-COVID related business is actually pretty brisk right now as far as government operations are concerned. So we have staffing issues associated with that also.
Jason, from your perspective, if the commission were to lighten restrictions, let's say on bars and gentlemen's clubs and that type of thing, video lottery, sort of nightlife, where do you see the ability to, what's reasonable there?
Well, I think it's just like Dave and Brad said, it's a nightmare to try to police that, especially because there's so many of them. And I know people are getting antsy and they want to get out and they want to be part of the group again. So, so if you restrict it, people are, you're going to have to entrust the businesses to follow the guidelines without us having to enforce it ourselves, I guess. I do know we'll probably get a lot of complaints because there's going to be those that maybe aren't allowed access and they think there is too many people in there or those types of things. So we just got to trust that everybody will do the right thing.
And I feel like they will, by and large, if we do get specific commission or health board level with recommendations, if there is specifics, I think by and large we can trust that they'll do their level best, but we'll still have an enforcement and it doesn't take away the level of communication that needs to happen. I think we've seen that, it's gone well and people still are communicating with us regularly. I think half of our days since the sort of start of this ordinance has been communicating with people on a personal level, communicating with employers, communicating with the businesses on how to comply and what we think is going to go forward. So, yeah, I feel like we can help them be specific. If there's a general recommendation for a guideline when we start to reopening, we can help them at a staff level on being specific according to their needs, as opposed to a one size fits all. We have some eating establishments, for example, that are pretty small. So, maybe there's some solutions there that could work, but wouldn't, or some solutions maybe at some of the larger places that wouldn't work for the smaller or vice versa. So we'll just see what comes of it. So what I've heard so far, just to move this along here, is that there's a recommendation right now to have the city commission extend the ordinance for a 2-week period of time. So 2 weeks from May 1st would be May the 15th, roughly. It goes till midnight on the 1st, so 11:59 on the 1st. So it's really by the time everyone would wake up in the morning on the 2nd. But there is a desire to omit tanning salons and dog groomers. Is that accurate?
Yes. And just so everyone knows, the commission would meet on May 11th. So we'd probably reconsider at that time.
Yeah, our next commission meeting then would be May 11th. So that would be reconsidered at that time. They can meet before that as well. I think I would add to the recommendation that, the commission not act this evening, but rather direct staff or depending upon what they want to do, whether they want to do this or they want to change and go a different direction, to give us time to recalibrate and get some language drafted. Also within that recommendation, then including that the businesses we would recommend allow be open follow CDC and OSHA guidelines for reopening, and we would be available to help with that. So I would draft that up. I haven't really given my opinion yet, so I'll do that for what it's worth. I agree that we haven't had any evidence presented to us from folks in the medical profession to tell me that there's enough data to support doing anything but extending the ordinance. I will say too, sometimes, plug your ears, Dr. Milroy, we don't always listen to our doctors. And I don't know if that's that's a good thing, but people don't always listen to their doctors either, because sometimes there's a will either on their individual behalf to do things like drink more coffee than they should, or something else, or there's a pressure, a societal pressure of some other kind of pressure that they don't listen to. But I think in this case, our job is to make the recommendation based on the information and data that we have, and we're not close to a point yet, I don't think, where we're going to have any testing or any level of a program, contact tracing or anything like that, where we can say we're safe to reopen. So at that point, I would concur with the recommendation. You know, I do feel like dog groomers wasn't part of our recommendation to begin with. I'm not sure how I feel about tanning salons, but I think, you know, for the sake of moving forward, I think the consensus is here. So I do see the mayor has perhaps jumped off the meeting, but I think we knew where he was at. So I'd like to vote on that just so it's a matter of record. So I guess I will say that maybe he'll jump on here, he'll jump back on, but for the time being, the recommendation of the City Health Board is to extend the ordinance for 2 weeks' time with the elimination of dog groomers and tanning salons, tanning bed operators, with the understanding that those businesses that we would recommend could reopen follow prescribed CDC and OSHA guidelines. So I guess I'm going to give him a hard time later, but since he's gone, I'm gonna make that motion.
I will second that motion.
Okay, so there is a motion and a second, and I think I see him.
He's back.
I see him coming on board. Mayor, I just made the recommendation that the health board recommends that we expand the ordinance for 2 weeks' time, with the exception of eliminating dog groomers and tanning bed operators, with the understanding that those two businesses allowed to reopen follow the prescribed guidelines for their businesses as put forth by the CDC and OSHA. And Dr. Milroy seconded that motion. We made it easy for you. So all in favor signify by saying aye.
Aye.
Opposed, same sign. Thank you. I will get this emailed to you all as well as to the commissioners, so they have it for this evening. 6 o'clock is our work session. And there's also lots of other, opportunities for folks to provide public input at the city commission meeting actually tonight. So I suspect that we will be looking at a redraft of our ordinance on Thursday at our meeting for the health board. So is there a motion from one of you to adjourn?
So moved.
I'll second.
Okay, all in favor to adjourn this meeting signify by saying aye.
Aye.
Oh, same sign. Okay, thank you. We'll see you all this evening.
Thank you.